A common advice I hear that is given to parents for their children is the child has to go outside, spend more time outside, and this will potentially help the myopia. Is this largely a case of what they're not doing, like being on devices when they're outside? Or what are the other factors?
That's a great point. Why do we feel that there's benefit of going outdoors? Well, I'll just put it in some context. This whole concept of spending more time outdoors for children to reduce the risk of myopia came about from some studies done in Asia, where they looked at school-age children, and they found that when children spent more time outdoors, at least 2 hours a day playing outdoors, that they had reduced rates of myopia progression. And so what is it exactly about being outdoors? Certainly, what you mentioned is important. Now much of our time is spent on screens, and including children, they spend a lot of time on screens, whether it's, doing schoolwork or playing games. And so reducing the amount of near work when someone is outdoors may be a part of the benefit of outdoor time for myopia. Also, it's been hypothesized that sunlight may play a role. Potentially exposure to natural sunlight may also help to reduce myopia progression. We don't yet know, but we do know that at least 2 hours a day is what's recommended. And depending on where you are in the world, some schools have actually mandated recess 2 hours a day during the school day so that children can get their 2 hours outside. Hopefully that spreads throughout more countries, but there are some countries experimenting with that.
That's fascinating to hear, Dr. Banik. I'd like to explore that further with you, the benefits of sun to vision. Just to take it back a little bit, you mentioned these near-focused tasks, like using devices. Could you say a little bit about what the effect is of devices, particularly on children developing myopia?
Absolutely. And I think to explain, it would be best to illustrate with an eye model, if that's okay.
Please.
For the audience. So in this eye model, I've shown this before in previous programs. So basically, when we look at the eye, we just see the very front part of the eye. But there's a lot of there are many structures inside the eye. So I'm going to give you a peek inside. That there are many, many structures inside the eye. But I'm going to show you one area in particular as I take apart the eye model. This brownish area here is called the ciliary body, and that is contiguous with the iris, which is the colored part of the eye. But there's a muscle in here called the ciliary muscle, the ciliary body muscle, and it's responsible for accommodation. And what that means is basically when we're looking at different distances, our ciliary muscle contracts at different amounts to help us focus images properly onto the back of the eye. So, for example, if we're looking at distance, the ciliary muscle is more relaxed and we're focused for far distance. When we're looking at something either at near, let's say about 14 inches or 33 centimeters, or even at intermediate distance, for example, our computer screen, that ciliary muscle has to contract. So that accommodation process is going on. And we think that when someone is accommodating quite a bit, that may be a trigger in children for the eye to elongate and to get longer, leading to myopia. So going back to your question, Brendon, you mentioned about near tasks, what could this link be between increased near work and myopia? It's because the ciliary muscle back here is constantly accommodating, and it's basically causing a trigger in the eye to elongate. That's what we believe. That's the theory out there.
Constantly tight, constantly.
Exactly, it's constantly working. And normally, I'll give you some perspective. If you think back to our ancestors in the hunter-gatherer, stage of civilization, most of the time our ancestors were looking in the distance. They were looking far off into the distance. They were, they were monitoring for any threats in the environment, and very little of their world was up close. They didn't read. They didn't usually write for prolonged periods of time. Maybe they did some near work like gardening, things like that. But the vast majority of time for our ancestors was spent looking far in the distance. So this shift from looking in the distance primarily to now most of our world, especially because we're on devices, is right here. And that means that the ciliary muscle is constantly active, leading to this trigger of myopia.
So this is kind of like an adaptation or a maladaptation to the circumstance of being constantly looking at devices and being near focused excessively.
Exactly. And actually, that's one of the the strategies we use when we're addressing myopia or progression of myopia, we do encourage our patients, especially children, to spend less time focused up close. So whether that be taking breaks if they're doing any device work or computer work or reading, even reading a book, for example, for hours on end, will stress that muscle of accommodation, that ciliary body. So any kind of near task is going to recruit that muscle and cause this accommodation process. Rather, again, going back to what I said earlier, taking frequent breaks is important to reduce the near demand. So instead of, reading for 3-4 hours on end, whether it's a device or screen or book, schedule breaks every 20 to 30 minutes and let your eyes relax and look off into the distance. So you're relaxing that ciliary muscle. In ophthalmology, we call this the 20-20-20 rule, which is basically every 20 minutes, take a 20-second break by looking at an object 20 feet away. So either look at something way across the room or maybe look out the window to allow that accommodation to relax. And then you can resume your near activity. The other thing that I think is really important, and perhaps a lot of people in the public are not aware of this, is that if someone is myopic, let's say their prescription, myopia is basically a prescription that's in the minus range. So -1, -5, -10. These are examples of myopic prescriptions. If someone is myopic and it's a relatively mild degree of myopia, let's say -5 or less, their natural focal point is actually here, like very close to their face. So if they're wearing their glasses or contacts for reading, that's really not necessary because they're naturally able to focus here. So I always tell parents of children who are myopic in that range of again, up to -5, that the children should take off their glasses for reading. Because what's happening is the glasses are prescribed for distance. And the child's wearing the glasses, and then they look from distance, and now they're reading wearing that distance prescription. That ciliary muscle has to work even harder to help them focus. So basically, it's really, really important for parents to realize this, that if a child is prescribed myopic correction, wear it mainly for distance and try to avoid them wearing the glasses or contacts for reading or computer use.
Following on from that, Dr. Banik, I understand that there's this circumstance where a person over a period of time will be repeatedly assessed and have their correction for their glasses raised, but that this isn't necessarily needed and that this can actually progress their myopia. Could you speak a little bit about that?
Yes, and actually, I've had that experience myself. I've lived through that experience, and I'll just share what happened with me. So I began to become myopic in my late teens, and I have a family history of myopia as well. So I was prescribed glasses, and initially my prescription was about a -2. But then over time, especially during medical school, as I was reading a lot, I was spending a lot of time up close, my prescription increased to a -5 in the right eye and -3 in the left eye. Now, I lived with that prescription for decades. I was wearing glasses or contacts corrected from -5, -3 for decades until finally I had something called a cycloplegic refraction. Now, that is basically drops are put in the eye, the dilating drops that most people get during an eye exam to check the back of the eye. Those drops are put in the eye. And what those drops do is that they paralyze this ciliary muscle over here. They paralyze this muscle. So the muscle is not able to contract. And when the drops are used, the true prescription becomes available. So there's a little bit of complicated optics here, so I'll try to explain it in lay terms. But basically, when a child is looking at distance, and even if they're a little bit myopic, they're trying really, really hard to focus. They're trying really hard to see the smaller letters, and this muscle kicks in. Even though they're not looking up close, they're looking at distance, this muscle can kick in when someone is really trying to strain to focus. So unfortunately, many young people are overcorrected because this accommodation muscle is active when it really shouldn't be. So the drops prevent that muscle from working, and it gives a true prescription. So back to what happened to me, when I had that cycloplegic refraction done, which was unfortunately in my 40s, I went for decades wearing the wrong prescription. And even as an eye care provider, I never actually went to get a proper cycloplegic refraction. What was discovered is that instead of a -5, my right eye was actually a -3.5. And instead of a -3, my left eye was actually a -150. So a huge decrease in my prescription because I was overcorrected for so many years. So I really encourage anyone who's listening, if you yourself are myopic and you're struggling and you're feeling some eye strain with your current prescription, or if you're the parent of a child who is myopic, you must request that cycloplegic refraction to get the true refraction so that muscle is not able to overact and sort of distort the refraction, the power. I hope that makes sense.
Yeah, that sounds like fantastic advice. A question comes from that: if the ciliary muscle is constantly tight, and that's what leads to people being given a higher prescription than they need, what allows the muscle to relax then when they have the appropriate prescription? Wouldn't they still need a higher prescription if the muscle is still in that tight state?
Well, that's sometimes what happens is some individuals have very overly active ciliary body muscles. And so they're constantly over focusing, you could say. And so they may get the glasses, but if their muscle is still active, it may be blurry. So they may not be seeing well. And so the goal is to really try to get the base prescription. And then even though it may be less than what the initial prescription was without the drops, people have to try to relax their eyes. And this is where, perhaps some exercises can be helpful. I am a big fan of something called palming, Palming, which is, it's actually one of the techniques that Dr. Bates had described in his original book, the Bates method. But basically palming is you rub your hands together, you put your palms over your eye sockets gently, don't push pressure on your eyes, but you prevent any light stimulus from getting in your eyes. And you do some meditative breathing during this. And it will help your body get more into a relaxed state rather than an overactive state. So I also do recommend that periodically, in addition to taking breaks to help deal with myopia, especially when it's progressing.
How often would you recommend people do that palming?
So when they do their breaks, from their work, whatever the near work is that they're doing, let's say every 20 to 30 minutes, they can combine palming with the 20-20-20 rule. So it's a nice break, or they can even stagger it. So maybe, every 30 minutes they do the 20-20-20 rule, and then the next 30 minutes then they do some palming. And palming does not have to be long. You can just do it for about 30 seconds, 1 minute to feel the effects. And immediately you'll realize if you put your palms over your eyes and do some really deep meditative breaths, you will find yourself relaxing and going into a parasympathetic state, which is again a state of relaxation in an attempt to relax that muscle.